this is crazy. It's supposed to be healthcare. And it was just mind-boggling.
There's such a great opportunity to lead in this space.
Find a partner that meets your needs.
Put yourself in the patient's shoes.
And when patients understand, patients are happy.
Organizations that succeed in this are going to be the ones that bring in RCM.
We're always looking for chances to do better.
The problem in our industry is
all right. Hey, everybody. Welcome back to another Vendor Voices episode. We're joined by Adam Plotkin of Healthcare Outsourcing Network today. Adam, how you doing?
Good. How's everyone doing today?
Well, they're excited to hear from you. I think that's how they're doing.
Well, I hope so.
Yeah, I'm confident. All right. So as we always do in our Vendor Voices episodes, we dive right into our Snapshot challenge. Adam, are you ready?
I'm ready. Let's do it.
Here we go. 5 minutes on the clock. Question number 1. Who is Healthcare Outsourcing Network?
All right. I think I can answer that one. Healthcare Outsourcing Network. We are based in Denver, and we represent hospitals across the country. I would say 3 main functions: self-pay early out services, insurance follow-up services, and call center support services.
All right. And who does Healthcare Outsourcing Network serve?
These days, most of our clients tend to be larger systems, but we have clients all across the board, a lot of standalone single facilities as well. And we've really never set a size as the requirement of who we'll work for and who we target. So really all across the spectrum of healthcare sizes.
All right. Question number 3. What problem is Healthcare Outsourcing Network solving?
Well, everyone, unfortunately, is seeing this continuing trend of increasing AR. And that's really our first and foremost primary function. We help hospitals reduce their AR, help them work more efficiently, more effectively, hopefully help them do more with less. And we're also trying to solve the problem, and this really got exacerbated when COVID hit. Hiring. Hiring has become a nightmare for facilities across the country. And we've been able to get around a lot of the problems. We'd be having them too if we were still hiring 90-something% from the Denver metro area. But now that we're a hybrid model with a lot of remote employees, we just have the economies of scale to get employees on board much quicker than most hospitals can do so themselves. If we're doing our job as we promise, the problem we're solving is we're reducing what goes out the back door to bad debt. If we're doing everything we promise to do, we're going to get those accounts resolved at a much earlier stage and hopefully reduce your bad debt expenses.
Something everyone should want. Question number 4. How is Healthcare Outsourcing Network solving that problem?
Well, we think we've got the best technology in the business, bar none. We're using a lot of AI-powered tools, basically covering everything from outbound call campaigns, IVR inbound strategies, RPA, chatbots. We do a lot with virtual agents, a lot with email, a lot of texting modules, which we think is really where the industry's heading. Even texting where we can do the financial assistance qualification process through text links, and the patients can upload what they need to get qualified right from a smartphone, from a desktop, from a laptop. So we're trying to make everything as easy as possible for the patient, and these systems allow your office to run 24/7. We also allow any patient that wants to deal with a human to have that human interaction as opposed to going strictly autonomous. So essentially, if I had to boil it down to one sentence, we're offering the maximum automation without ever sacrificing the human element.
All right. And question number 5. How is HON solving that problem differently?
Well, I think a big part of it is all we do is early out. We don't do any bad debt. We never have. I think a lot of our competitors are collection agencies dabbling in early out, but for us, if we don't recover, we don't get paid. We don't have another service on the back end at a higher rate lurking out there. We also only handle healthcare, and we feel specialization is a key. I mean, think about it, since we're all in healthcare. If you need, God forbid, you need brain surgery, do you call your podiatrist? You don't. You don't even call the general practitioner. You go to the specialist because that's where you'll get the best service. In light of all of the technology we talked about, we still think that you have to use it to get the patient on the phone. That's a key element. Everyone wants to do things by blast statements and blast robocalls these days, and they have a part in what we do. But if that's what you're basing your process on, that's simply not enough. That's not where you get your maximum recoveries. With all of this technology, we've always made it a point to also stay hands-on. Our clients have my cell number. They have my partner's cell phone number. Don't have to deal with me. Not everybody wants to. We have the same structure everyone else would have with directors, team leads, etc. Clients can go to them, but if they want to come straight to the ownership, they can do that as well. And another big thing that's different is there's this myth that's always been out there that you have to sacrifice customer service to maximize recoveries. We think that's nonsense. These are not two mutually exclusive concepts. In fact, it's exactly the opposite. There's the old adage that you get more flies with honey than vinegar. If you're not creating an optimal patient experience, you won't succeed. Not in this industry, not on non-default accounts. And we've always kept that in mind in the way we structure the business. And that's why we don't cut any corners. We spend whatever it takes to provide that optimum experience for the patient, because by putting the patient first, the bottom line will follow.
All right, Adam, thank you for taking the snapshot challenge. Something caught my attention there at the end that I would even jump on even farther, and something I've been thinking a lot about in 2025, and I think is going to become a bigger and bigger thing here. The patient financial experience, everybody knows that has been a growing topic, let's just say, of importance. But we, in the revenue cycle, at least, we tend to think about that single patient experience or that single patient account and collecting on that single account. But keeping that patient happy is what's going to keep that patient lifetime value. And I think that's something healthcare finance is going to start to grow to talk more about, really nurturing that relationship with patients, keeping them coming back to your facility. Because yes, that one account is critical and it is important, but it's pennies compared to the lifetime of that patient, especially as they get older and they need more care. But anyway, Adam, thanks for taking the challenge. Let's tell the listeners a little bit more about you. Why don't you tell us about yourself?
Myself. Well, I started out with my very first job at a law school, and you don't go to law school necessarily and they say, what do you want to do? I want to work for a collection agency. That was the job that was available. And that's where I found myself, literally fresh off of passing the bar exam, in-house counsel for a collection agency based in Denver. And it led indirectly to the genesis of Healthcare Outsourcing Network, because what we saw very quickly was just an astronomical number of patients in the bad debt process who would say, if I ever had been contacted by your client, I would have paid this. And at first you chalk it up to, well, they're embarrassed, they feel bad it got to the bad debt point, and they're just making excuses. Well, that number and the percentage of accounts where people said this just got higher and higher. So we started doing a little digging, and lo and behold, that's what we found. Some of these people some had not even gotten a statement. And so the thought process became, and keep in mind, this is back when bad debt agencies were routinely charging a 50% fee. Well, they sent out a letter. They got a 50% fee. We don't need anywhere near that. We could be in the single digits. What if we gave the technology? What if we gave the staffing to make sure every account was not just getting a statement, but getting multiple statements, multiple contacts? Would that then would it accelerate the revenue cycle to the front end? And would it be a three-way win? Well, the hospital's happy. They get their money up front. Things don't go to bad debt at higher rates. Patient is happy who wants to go to bad debt, which could include credit reporting. It could include litigation at some point. We would be happy if this business model worked and we can make a reasonable profit. So it ended up being I think it's pretty rare to be a win-win-win. And lo and behold, it worked. And here we are 28 years later. I think we've morphed into some different services, but the core model still stands.
Yeah, and therein lies the birth of Healthcare Outsourcing Network, or what we'll also refer to as HON today. And Adam brushed over the fact that he went to law school. He has you still have technically you're still on the bar, right? Or how do you say it?
Yeah, unless you get in some kind of trouble, which we haven't. You're always a lawyer. And for a long time, up until a few years ago, I was practicing actively, and we had a law firm going at the same time as HON. And, to this day, I would love to be doing trials. I always thought that was the fascinating part of the practice of law. But what happens over time is you get to a point where you have to pick one or the other. For me, it got to the point, two things happened. I felt that it was time to focus exclusively on HON, and we had the good fortune, we had a case go all the way to the US Supreme Court. And so in my mind, it sort of became, especially doing this type of work, I never expected a case to get to the US Supreme Court in creditors' rights. I felt there wasn't all that much left to do on the legal side. I thought I had accomplished what I set out to do as a lawyer, and I thought this was just the better career path going forward. So I think it was probably about 5, 6 years ago that I really decided, yeah, I think probably time to stop going into court routinely and focus on HON.
Yeah, tough decision. So I'm going to ask you more,
Sure.
tapping into that legal background. Let's talk policy a little bit. I know you and I just kind of in passing, and we somehow every once in a while get to talking about policy. Obviously, it plays a significant role in healthcare finance and in revenue cycle. So how can us non-lawyers keep up with these million-page memos, let alone understand that with all these constantly changing healthcare laws and policies? What can we do to keep up?
Well, I do think trade associations are a big way. I think HFMA is a great resource for that. I don't think, unless you are the compliance officer, I don't think you really are expected to sit down and read through reams and reams of bills and rules and regulations. You want to find the summaries of the information. You want to go to sessions with trusted speakers breaking it down. I do think as the framework we all work within gets more and more complex, and it's an ever-changing playing field, will always be new laws. There will always be new rules and regulations governing what we all do. I do think it helps to have someone with a law degree somewhere on staff. And I realize that's not practical for all companies, depending upon your size. There's no legal requirement for a compliance officer to be a lawyer, but I do think with each passing year, it does help. It helps to have just the training in the background to break down something that's very complex and get it into a digestible format, something that you can then pass down and train your staff on, because that's great if the high-level management understands the laws that we're dealing with, but it doesn't find its way into the training and get down to all levels of the staff of a company. That's a train wreck waiting to happen. So I don't think people should be daunted. I don't think they should be afraid. It's nothing new that we have to deal with laws all the time. It's just that they're constantly changing.
This show was brought to you by Real Partners Consulting, a free-to-provider vendor selection support company. We help healthcare providers find the right revenue cycle partners across technology, consulting, and managed services at no cost to you. If you like what you heard from today's guest, or if you're looking for any other partner in the revenue cycle space, let us do the heavy lifting for you. Reach out to me, your host, Ryan Downs, on LinkedIn or at rdowns@realpartnersconsulting.com, and I will personally help you find the right fit. Now let's get back to the episode. So I might open a can of worms here. What would you say to somebody that says ChatGPT is my lawyer?
Well, I would say you're not alone. A couple of lawyers have done that. They have used ChatGPT to draft their briefs that they have submitted to the court. And we've already got a few cases coming down where some lawyers have been sanctioned because ChatGPT was incorrect. The lawyer didn't bother to check what ChatGPT put together and put an erroneous citation or proposition in front of the court. And the courts thus far have been pretty uniform on that and saying, that's not what you get paid to do. You come into my courtroom, you put your name on this document, and it isn't accurate, you don't then get to say, well, but that's what the computer said. Sanction the computer. This isn't a gray area. We already know, and it's been pretty uniform. If you're going to take that risk, not only are you going to pay the piper? It's not if it's wrong, it's when it's wrong. It will do something that is incorrect that a lawyer reviewing, doing the work properly would have caught. And there's really been no mercy so far when these cases have cropped up. So it's cautionary tale, I think. Doesn't mean it doesn't have its place. I would liken it to when internet research first came out. Would you ever cite Wikipedia as fact? Of course not. But you probably do sometimes start there. Just as a starting point, see what it comes up. See if it points you in the right direction. Think of this sort of like that, only a lot better, a lot more accurate, and with a lot more potential. I mean, we may be sitting here in 10 years saying, do you remember when lawyers used to actually look up cases and they used to go to court? Now it's ChatGPT and the hologram is projected into the courtroom. We don't even know where this is going yet, but we're not there yet.
Yeah.
Govern yourselves accordingly. When you put your name on something, it doesn't mean you have to be a lawyer. Just think about your own companies. Someone who you report to gives you a project, and you simply go ChatGPT it and turn it in, and it's wrong. Is that going to bode well for your advancement in your company? Of course not. And I think sometimes people are looking for a little too much at this point from ChatGPT and the other services out there. They're in their infancy. They've got a long way to go. Phenomenal technology. Who thought this would even be at this point by now? I think we're all kind of blown away of how fast it's moving. But it's not at a point where you can turn off your human brain and let the machines do it all. And that's kind of a recurring theme you're going to hear from me today. I mean, that's something that has been in our business model from day one. Automate everything that you can that is able to work well in that format, but never give up that human element. And I use an example a lot when talking just about with the work we do. I am probably paying my bills from a hotel room at 3 in the morning on my smartphone. I don't want to talk to an account rep unless I have a specific question that can't be answered through automation. But conversely, my mother isn't going to pay her bills that way. There's a bit of a generational thing here. She wants a human being to get on the phone, walk her through the process, read her the confirmation of her payment that she can then write down. And I think you have to offer both. Offer, if you can automate for those of us that want to use it, great. You're freeing up your live bodies for the people that want a live body. And I do think there's a generational component. Also don't want to, you guys are going to think I'm picking on my mom. I'm not, I love her dearly. Force her into the automated system. Here's how that goes. Oh, she'll get to a human. It might not be that day. It might be next day. It might be the day after that. It may be every day for a week. And she'll get all the way up to your C-suite. She's good at that. She's got a lot of time. She wants to let them know how unhappy she was not being given the service she wanted. Why would you want to create that scenario? Yes, it costs a little more money. It's a service industry. Serve people the way they want to be served. Maintain that human element. It isn't going away in a well-run company anytime soon.
Absolutely. Yeah. I think coming back to use of AI, it is a tool. It is a technology. It is not a silver bullet. To make it a real example, kind of in the policy space, I was talking with somebody yesterday who actually one of his teammates submitted a project that he was then reviewing, or a presentation rather, that he was reviewing. He's like, I don't think this is right. Sure enough, they got their information from AI, from, ChatGPT, Copilot, Gemini, whatever it was, and it had referenced a prior policy, right? It didn't reference the new policy. And so it would have been correct had there not been a newer policy. But when you think of it that way, when I heard that example, I'm like, well, yeah, that actually, I could see how the technology would, quote, screw up, right? If I didn't prompt it very
Sure.
clearly. And we have a lot of confusing and changing and specific language in revenue cycle and in healthcare. And I think that makes it challenging to use AI. I will say use it. You absolutely should use it. I use it every day. but I check the sources every single day too before
And
I
that's the
publish
key.
anything.
That's the key.
And if it points me to a legal document that's a million pages long, no, I'm not going to read it all, nor am I qualified to. But I am going to go into it and I'm going to control F and I'm going to find that keyword for that part that was important to me. And I'm going to read that part of it and maybe ask ChatGPT a few questions more after that. Say, hey, what about this? What about that? What about that? Do a little bit more vetting, right? And if it's critical, if it's with a client that I'm bringing that forward to, and it's not just, like a post on LinkedIn, I'm going to make sure they know exactly how I got to that information. Or I'm going to bring in a SME to vet it further. But I want to ask you one more thing
Sure.
before we take your legal hat off and get back into the business that HON does and some best practices there. Everyone's been talking about One Big Beautiful Bill, OB3, whatever you want to call it, for quite some time now, and they should be. They absolutely should be. I want to know from you, what's another healthcare policy that maybe you're watching that the rest of us aren't watching so closely?
Sure. Can I take it a little slightly tangentially? Because
Yeah,
I don't think
absolutely.
this is exactly what you're getting at. I think you wanted me to say, like, well, there's this new law coming out. You may not have heard of it yet, but I think this is actually more important. And I've been thinking about this a lot lately. When the whole Change United breach occurred, it's all we talked about for how many months, all of us. And it almost feels in the last couple of months like the initial horror, people are back up and running, they're getting their claims out, has subsided. It's enough in the rearview mirror that we've kind of let this issue go. It's almost like there's a feeling of, okay, we got through it. It's the beginning of the end. There's that old famous Winston Churchill quote, it isn't the beginning of the end, it's the end of the beginning. I don't even think we're at the end of the beginning in these types of hacks and breaches. I think also it's in its infancy. And I'm not sure we took out of this yet what I think should be one of the main lessons, which is, boy, the day of giving everything to any one partner, it's over. It should have been, at least it should be, because think how damaging this hack was. Now think, what if they get into one of the legacy software systems? It's hard to imagine that not happening. It's hard to imagine that not being what they're targeting. And if you had a breach into a legacy system, how crippling would that be? And the more functions any one vendor has, if they are hacked and shut down temporarily, I think you have to be asking, how damaging is that to your organization? Depending what features and how many that vendor has, okay, are we no longer talking how damaging? Is this an end of business event for your organization? And I don't think it's fair to say we're just ignoring it, but it seems like the fear factor has subsided a little, and maybe we're not being as proactive and discussing this.
Yeah. Yeah, that was
Where do you go from there?
yeah, that's what you saw at every conference in 2024, right? After it
Right.
did happen. I think it was February 24. And it was, yeah, what is your contingency plan? What do you do if you get a cyber attack? What do you do if you get hacked? What are you doing to prevent those things? So yeah, I mean, I think it is a huge risk. I was saying this similar thing. I mean, I'll say it more directly back in 24. Gosh, what if this happened to Epic? What if this happened to Oracle Cerner? And I believe there was,
I think it'd be
if I remember
devastating.
correctly. Yeah, and not even just for those organizations or for the organizations that use them, for actual patient care. Like that's the scary part.
Right.
If all of a sudden you're in the middle of you know, a critical surgery, treatment, whatever the case, and now your medical records can't be accessed. I
Well,
mean, that's your
and
health.
look, here's the scary component of it. We're in a constant battle now between the hackers and the software security companies. And I think that if you talk to anybody in the security field, they will tell you, hey, look, they're doing everything they can to stay one step ahead, but they're going to lose every now and then and have to come up with a solution to fix the new, latest, greatest technique by the hackers. So, this idea that any system is 100% safe Well, let's even say if that's theoretically possible, that as you and I sit here today, we can say our system is 100% safe. Well, can you say that it is tomorrow or next week?
Sure.
Because, like I said, you've got this whole army of bad actors out there, and they are constantly working round the clock to come up with something to circumvent the latest and greatest in security. And so I think that's why this is, to me, such a key issue. Like you just said, well, what is your contingency plan? And the more key roles that you have rolled into any one partner, the more at risk you are if that partner does have an issue. So I just think it's something we need to get back to a little bit. We all had, I don't know what the right word is. Is there a term, change fatigue? I think we all had
Mm,
the change hack fatigue. It was all, like you said, it's all we talked about for how many months at conferences. And now maybe the pendulum swung the other way. I'm not sure we're giving it its due attention because, well, the new shiny thing came along. We like to talk about AI
right.
nonstop because let's face it, it's useful, it's groundbreaking, it's cool, it's got that wow factor. But I think we need to get back to this a little bit.
Maybe a better response than getting an individual policy right. And there's going to be new policies all the time. That I think is a really important reminder. I really do. I agree. So I'm glad you brought it up. So let's switch gears back into healthcare finance, back into revenue cycle here. What HAN is really good at in the early out space. So what we like to do in the show is make sure we're giving away tangible advice. We're educating our listeners who can hopefully go back to their organizations and make them better. So can you share with us a couple of tips that, again, our listeners could take away, maybe even begin to implement right away in areas like early out?
Sure, sure. No, happy to do that. I think we've got so much great technology available to us right now in the early out space that make sure you're up on it because I really think it's evolving so quickly that if you're not already using things like RPA, robotic process automation, chatbots, virtual agents, text modules, I can't see why texting wouldn't be such a direction we move in as we go into the future because the cost is better, the timing, the speed, um, the studies that are already out there of the response rates that you can get from certain types of communications versus the traditional paper statement or a blast call. If you're not already using some of these items, you're probably behind a bit. If you're not at least getting up to speed on them, investigating them, learning about them, deciding which ones are right for your organization, you're way behind the pack at this point. You
Yeah.
really are. And, I always like to say, stay on top of it. Don't become a dinosaur. We know what happened to them, right? It didn't go so well. That's where we're at with this stuff. And it is moving so quickly. And I also think there's always a little bit, sometimes folks say, oh gosh, well, that's so new. Will our patients accept it? You don't simply turn this stuff on from 0 to 100 on day one. You phase it in slowly. Adjust your patient community. When we take on a new client, I've always been surprised how many times we're told we don't do any outbound calling. Really? And no one's doing any for you. Okay, I know when I hear that, we're going to make an immediate and a very significant impact in their revenue. But I can't come in and go from where this patient population got no outbound calls and call them every day. You know what'll light up like a Christmas tree? Their complaint line at the
Hmm.
facility. So I think I would urge people think of it that way. Where I'm not saying bring in all these new things and scare your patients. Phase it in. And I think you'll be amazed how much they start asking for it and asking for more along those lines because all of these items are geared towards making it a better process and experience for the patient. And that's the other thing we have found when we implement these types of technologies. Most patients love it. Again, there'll always be a portion that don't want to use it. Fine, don't force them into it, but watch your timing, what you're doing. I think if you're saying, well, healthcare will never accept that, I think you're mistaken. And if you're not up to speed in getting some of these items implemented, you really want to work on that.
Yeah.
I know I touched on it earlier, but I do think if you ever sacrifice the human element, you'll have a problem. It's probably not fair, but we've all said at some point in our careers, yeah, but this is healthcare. I don't know where that came from. I don't know why it's treated differently than any other industry, even by all of us. Maybe it's as simple as nobody wants to get sick. Nobody wants to go to the hospital. So maybe it's that added level of empathy and sympathy that we all have to use in our daily work. But wherever it came from, this is a different industry. I do not believe it will ever 100% say, the heck with human beings. We don't need them in the process anymore. So I would say keep that in mind. On the early outside, understand your job is to never fight with a patient. Don't fall into the trap of thinking it's possible to achieve 100% recoveries at the early out stage. It isn't. There are accounts that need to go to bad debt before they'll pay you. Your job on the early out stage is to identify those accounts. Find the person that is just looking to have a fight, politely move on, end the call politely, cancel it back to your client to forward to bad debt. There is a time and a place for bad debt in the process. But ensure that every account, if you think back to the story of where'd the idea come from for HON, make sure every account has been contacted numerous times. Get the meat off the bone, so to speak, so that when you do cancel something to bad debt, yeah, it's bad debt. Don't send an account that if you called them once or twice would have paid you to bad debt. That's just throwing money out the door.
Yeah, definitely. It feels like it's not even that long ago when it was, I don't know if I'd say the norm, but at least common to send statements and that's it. And then have an inbound call center, with the number on those statements. But yeah, I mean, nowadays, if that's all you're doing, you're way behind. If you are
Way
turning
behind.
into a dinosaur, let me know. My son would love to talk to you, but don't. We got enough. We got enough for him to play with. So yeah, so if you're just sending statements, look yourself in the mirror real quick. If you're not doing outbound calls, I heard you absolutely should be. There's a material impact. Oftentimes, you're going to want to partner in these things, especially if you then take it a step further, which you also, I agree, should do as well, right? So it's not just phone calls, it's not just statements. You should be doing things like text. If you have a platform or a portal like a MyChart,
Right.
there's ways to communicate in different ways. So the multiple lines of communications that serve, whether it be different generations or different preferences, and I know some organizations now too, you can give your patients or identify patients which want to be served in a certain way, right? So maybe they'll
Right.
actually come out and tell you we want texts. Okay, great, then we'll give you text.
Well, like you said about the same thing as don't fall into the trap of just sending statements. Don't fall into the equal trap of just doing blast robocalls because it's become the new statement. There are so many patients out there pick up that phone the minute they see that's what it is, they hang up. They don't even know they got
Of
a call
course.
from you. So, like I think we touched earlier, it can be an effective part, one of the many different mediums you offer. But I see marketing. This is all you need. Oh, we'll make thousands of them a day. There's a difference between a contact and what we call a quality contact, and that's not a quality contact. It's just something to be wary of.
Gotcha. Yeah, so important, but in a different way. I like that. I like that distinction. Any other tips on the other lines of business you have, maybe call centers or something like that? Real practical advice.
Yeah, I think the same items apply on the call center side. And I think, again, on any service line, let's talk a little bit about training. I think, you're only as good as your people, any entity, any type of business, and your people are only as good as the training they receive. Nobody comes into a job ready to just hit the ground running. They need to have a good, solid training process. And I think that's a very key element to constantly be reviewing because, as we talked, the never ending, constantly shifting playing field, that means your training has to constantly be shifting too. It also means your training has to be ongoing. An initial training course, as good as it is, if then there's no ongoing training and you have employees with years long tenure, well, that's a problem. You have to make sure that it's ongoing. Um, Hire wisely. Find out what works for you. I know for us, We used to think when we first started 28 years ago, the gold standard was someone with healthcare billing background. And we found out very quickly it wasn't. Not for what we do. The gold standard was someone with a customer service background. Because through our training, we could teach someone everything they need to know about a day in the life of an account in the revenue cycle. We can teach them that. There is no way to teach a good disposition. You can't take a nasty person and make them nice. And if you don't have a good disposition in this industry, early out, call center work, you're finished. That's just a death blow. You can train on how to make somebody more customer service friendly. Absolutely. But you can't change the core being. And this is not a job for everyone. Frankly, I couldn't do it. I couldn't sit on the phone talking to patients all day. I don't think I would really enjoy it. And I think that would eventually show. I can teach it. I can say this is what we need to look for. But I've been around long enough to know that I don't know that my 200th call on Friday would be getting the most empathetic, sympathetic version of me. And that's what you need to find. So hire wisely. It's become more and more difficult. There are fewer good candidates out there. Don't put a body on the phone talking to patients, especially on current receivables, just because you couldn't find who you really wanted. They're out there. You just have to dig a little bit harder. You just have to do more thorough vetting, more thorough training. And again, on the call center, mix it up. Use a wide variety of techniques. You want to be offering your patients the ability to take payments however they want to give them to you. I say that because everyone has multiple creditors, correct? So what you want to do in this industry is find a way to get your accounts to the top of their list. Who are they going to pay first? And that's why I say if you have, you make up numbers, you have a dozen bills every month. And let's say you only have X amount of disposable income for bills this month. Are you going to pay the creditor that sends you a monthly statement in perpetuity and that's all you ever hear from them? Or the one that calls and you have a very polite interaction, but repeated calls from a different creditor? I think you're going to pay the one that is constantly interacting with you, especially if they're interacting with you sometimes with a human being on the phone. You are, in essence, accelerating yourself to the top of the pyramid of needs. Who should I pay? Without ever being offensive, without being aggressive, without being nasty. But you're staying in contact. And that's who we find people will pay, the creditors that are in contact with them, and where it's not just a mechanized process where they know no thought's gone into it.
Yeah, I think good advice for the world as a whole and more than just a call center, right? Have empathy, be good people, be nice to people. And you know what? Sometimes they'll be nice back to you. But I think hiring, retaining, training are all things with this growing technology. I hate to keep bringing things back to AI. I guess that's just on my brain right now. But as that grows and our employees all get upskilled, right, and work to the top of their abilities, it's going to be even more important to get those people with the intangibles and the soft skills and the work ethic and the empathy. And we can train them on the rest and they can train themselves if they have the right work ethic and willpower, right, through these tools that are going to become more and more available.
Yeah.
So thanks, Adam. That's all the questions that I had lined up. I appreciate the time. I do want to give you, like I give everybody, the opportunity here to speak to our listeners directly. Any final parting advice for them?
Yeah, sure. I would say never forget we're a service industry, and if we hang up the phone and the patient's not happy, we've failed. I think we always need to keep that in the back of our minds that we're here to service the patient. That's really what we are. And if you're not using I call it a patient-centric model, you probably need to re-examine that. And choosing a vendor is a serious item. Make sure you get to know the people. Not everyone is going to want to work with me. Not everyone is going to want to work with one of my competitors. There are so many of us out there, and there are so many facilities out there looking for partners. Find a partner that meets your needs. Have you ever asked them, what are your corporate values? What's your corporate mission statement? Does it match yours? You could find somebody where they do fine work, but they just have such a different structure, such different values than your organization, that it's not going to be a good long-term fit. Before you turn over millions and millions of dollars, potentially millions of direct patient contacts, these are your patients. Get to know us. Don't do it blindly. Interview people. Make sure you're a fit.
Yeah, absolutely. Glad you bring that up. When vetting and determining who your partners are going to be, it's not just like a risk reduction thing. Who's going to, or a full ROI in terms of who's going to deliver on this project for me with the lowest risk. It is empowering and unleashing many things that are going to happen beyond just that direct scope of work. And you don't find that just by reading some RFP responses. You need to take the time to, as you would hire a leader with intent and through a formal process, you need to do the same thing with your vendor selection. But anyway, Adam, thanks so much.
No, thank you. Thank you, Ron. And I love this series. I think you're really onto something here.
That's a wrap on yet another episode of Vendor Voices. Huge thanks to our guests for their insights and to you for listening. If this episode gave you something to think about, share it with your team. If you'd like to suggest a specific topic or guest, feel free to reach out to me on LinkedIn or at rdowns@realpartnersconsulting.com. Please rate and review, and be sure to subscribe to never miss an episode. I'm Ryan Downs. Thanks for tuning in.